Welcome to another episode of I Wonder, Doctor.
Let's talk about leaky gut and autoimmune disease.
So you're making a connection between the gut and things like lupus, right? Like arthritis.
Exactly.
Huh.
And there's a lot of causes of these illnesses, but I want to focus in on one of them.
Yeah.
And I first learned about it from a mentor of mine who was telling me the story of a patient in Tennessee who went to their doctor because they had diarrhea, diagnosed as having amoebic dysentery,
Yeah.
and was taking a certain anti-amoebic medication. And months later he called up the doctor and said, "Is that anti-amoebic medicine good for arthritis? Because for the first time in 20 years I have no pain in my joints." And boy, did that spark some interest in the medical field. And here's what it's come down to, and I want to illustrate this for you if I can. Here we have my rendition of an amoeba,
Yeah.
and the immune system is not going to tolerate that. And it's going to send out factors that are going to try and identify that amoeba, and it does so, and here I'm going to do an ultramicroscopic view of the cell lining. That's what the immune system encounters, is the outer cell membrane.
Yeah.
And it's going to try and replicate a mirror image of what it encounters, proteins and lipids. And it's actually like a key in a lock. It forms a mirror image, and that mirror image then travels off to the rest of the immune system and says, "See this? We're being attacked by the mirror image of this."
It identifies one soldier and said there's got to be a lot of other ones out there like it. Let's go get those guys.
Exactly. And
Yeah.
so the body produces a lot of antibodies,
Yeah.
and they go tie up those amoeba and prepare them for destruction by the rest of the immune system, for example, the white blood cells.
Yeah.
Antibody response.
Right.
Well, it turned out that the antibodies that attacked the amoeba were similar enough to be able to identify joint protein. After all, an amoeba surface is a cell. It's made of proteins and lipids, for example.
Yeah.
The same antibody that attacked that amoeba identified the patient's own joint protein as foreign.
It looked so much like the amoeba, it accidentally attacked those joints.
Exactly.
Yeah.
And it was a provoked immune system. It wasn't autoimmune. It was an antibody system that was specifically provoked, and it happened to cross-react with joint protein.
Yeah.
Or with the thyroid gland, for example, or the thyroid globule and a transport protein, or the eyes or the salivary glands, or the skin in the case of lupus.
You're talking about all those autoimmune diseases.
Exactly. And I'm
Yeah.
not saying everyone with autoimmune disease has a particular infection that's provoked this.
Yeah.
In fact, food can provoke it. Remember in talking about what can go wrong with digestion, that the immune system can have to attack protein fragments, for example. Common example of this is gluten. This is in wheat.
We sure hear this one a lot. There's gluten-free that and gluten-free this.
Right.
Yeah.
Brand new thing has emerged in our lexicon in
Yeah.
America.
Yeah.
For a very good reason, because there's nothing evil about wheat, but
Yeah.
it happens to be technically very difficult to digest. Well, picture this. When I was a kid, we added water to white flour, and we formed something that was like a rock.
Yeah, you're
That
talking about
glue,
paper mache.
gluten, exactly. That
Yeah.
glue, that gluten is very intense molecule to break down. It gets partially broken down, and that can provoke an immune response to it, which can be similar enough to joint protein as well, and attack joint protein. There's a lot of people out there that when they eliminate gluten entirely, and you have to do it entirely, you can't leave a few specks and this and that, their joint aches go away, and a lot of other stuff too. So this is a very important subject.
So it's an ongoing process. Maybe I eat some gluten, the body identifies that gluten, tries to break up that gluten, and the more gluten I eat, the more it says, well, I better go kill everything that looks like this sucker, break
Right.
these guys down, and so thus it keeps attacking the joints. You're saying I've got to get rid of, in this case, all gluten, if that
Yeah,
happens to be my
that's
thing,
right.
so that I'll stop making little replicates that go out there and start attacking the joints.
Exactly.
Yeah.
And really, we're in the general territory of how the immune system can be provoked by specific germs or specific food molecules.
Yeah.
And there can be enough similarity to tissues in our own body that the same antibodies that are protecting us wound up attacking our own body, so-called autoimmune. It's not.
Yeah.
Now, I don't want to oversimplify autoimmune because it takes us into this whole area of something called psychosomatic medicine. For example, there are people who have thyroiditis, and when you talk to them, you see they have trouble expressing themselves through their throat there. And these antibodies do not attack the larynx, the voice box.
Yeah.
And then you help these people psychologically identify their needs, communicate them in a more effective way, speak up, go to Toastmasters, whatever it is.
Yeah, right.
And that helps quiet down their immune system. So we are a very intricate and fascinating and amazing system, and this is in the area of psychosomatic medicine, folks. Might as well get used to it because it's happening, and medical doctors have known about this for a long period of time. So again, autoimmune illness may not be as simple as germs or wheat.
But the takeaway is we can do things to help our autoimmune diseases. If we've got them, we can reduce them.
Exactly.
Yeah.
We can heal.
We can heal. Great. Thanks.